Oh, it says it now.
I
Like
clicked it.
up
Okay. Okay, we're good now.
recording.
Yes.
Mhm.
Okay. So, we'll start off by talking about the PT's role with case management. One of my
I guess we should say while it's recording the case that we did.
oh yes, go
Yeah.
ahead.
Yeah.
You can say
So
that.
we chose the case with the patient with traumatic brain injury and shoulder amputation.
Yes. Great. Yes, that's good. Good detail.
Yeah.
And with that, with like a shoulder amputation, one of the points I thought of was if he would eventually want to use a prosthetic. And so kind of just going into when we are talking about like advocacy for advocating for those resources that can provide his prosthetic. I feel like it's really important for us to like document reasons why he can have improved function with his prosthetic if he chooses to use one. So yeah, just kind of talking about like how our importance of getting him the resources and abilities to have a prosthetic that's accessible and that he's like that he can easily get, because I feel like stuff like that can become really difficult to obtain.
Mhm. Yeah, and I think since it's like this is a big life shift for that patient, um, like they probably don't know that there are probably groups out there that like support groups or just like resources. So I put that we're since we're more in that area, we'll probably have better access or knowledge of like groups in like our local area. So providing those resources to them so they can have like a community to like talk to.
Yeah, kind of like piggybacking off of that, talking about like patient education. In that video that she posted for us to watch, it just talked about like how different professions kind of interact with each other and kind of like if something's out of your scope of practice, like we have the knowledge of finding someone who could help them with something that maybe we can't help them with. So it's like kind of like what you said, Georgia, like having those other resources on who has specific expertise in what, and who we could refer them out for.
Yeah. One of the professions that was kind of mentioned further down in the document that she shared was a prosthetist. So someone who specializes in fitting a prosthetic. And so I think the patient or the PT and the prosthetist, I think I'm saying that right, would all be working very closely, collaborating with what that would look like in terms of functional um, capacity and tasks that they could do. So I think, yeah, that also ties into that with that
I
role.
did pick a prosthetist as my person, so I have a bunch of
Oh, that
stuff
is
that
okay. So
I don't
Brandon
really
can
Perfect.
share when we kind of
know
move into
now
that
or
direction.
do
Sorry, what's that, Brandon?
you want me to just go into it now or should I wait
I think
till
we can still keep talking about the PT's role in this case. Um, what I noticed was the functional status of the patient and their bed mobility and transfers and how they develop some independence, like where we're at currently with the patient. But I would imagine that early on in this patient's case, um, he had to learn how to do a lot of those things, and that would be a huge role for the physical therapist, would be to help facilitate strategies for bed mobility and transfers after losing a limb. And so I saw that as like one of the very early, maybe while he's even in, like I think the case said he got the amputation the first day of. And so just immediately after, I would imagine that the PT's role would kind of be helping him relearn weight shifting strategies. That's a big, loss to kind of recalibrate your vestibular system with. And so I see that as like a really huge fundamental role for the PT early on in the case. And that's not even going into like the things that they can do to help manage the TBI symptoms.
Yeah, I kind of had that too because he got his right arm amputated, right? I don't think the case ever said like which arm was like his strong arm, but I'm just gonna assume it's right based off
Hmm.
stats. But
There was
he's been
another point in there that said it's like impaired like left upper extremity coordination. So I kind of just assumed he was right hand dominant.
Yeah.
yeah.
So, but good point.
So he's gonna have to learn all sorts of different compensatory strategies for just everyday things if he's without his dominant arm. So I talked about that a little bit.
Mhm. Next question.
Yeah, we can move on. So discussing the PTA's involvement in this case. So I guess I definitely think PTAs are valuable in different situations. And I was kind of referring back to what we talked about in resource management, was like depending on the patient. Obviously PTAs can't do as much as like PTs can. But I think with this patient specifically, talking about improving like bed mobility, gait training, transfers, like a PTA could really come in handy with stuff like that. But obviously, if this patient is a little bit more complex, like I know that said they were like Ranchos 5 to 6, obviously I would assume like the PT is probably directing most of the care and is like probably there kind of like overseeing stuff. But I do see value in a PTA and like being able to help this patient.
Yeah, I would agree with that. I think there's like, and it also kind of depends on how the PTA and the PT work together, right? I've been in clinics where the PT will supervise and they'll be working collaboratively side by side. And then there's other forms of collaboration where it's more they're directing the PTA and they step aside and the PTA kind of takes over that plan of care. And so creating a good strategy with the PT and the PTA to kind of understand how they're going to work together to help the patient, I think is really important. The other thing I think would be really useful to have the PTA there is for like the balance strategies, and building more awareness, proprioceptive awareness, when they're dealing with like those kinds of tasks. I think there was something in here. Um, yeah, he's got impaired standing balance, impaired dynamic standing balance. And so it would be nice to have a PTA to also assist in guarding when you're working on training those systems. I think that would be really useful.
Mhm. I had that same comment on there about having like the additional hands for safety, especially because if they work alongside the PT all the time, then they're well versed in how they like probably will plan to do it, and also are just knowledgeable in similar areas. So it's probably nice to have like someone who's like similarly educated than like some CNA that probably has never guarded a patient before.
Yeah.
Yeah, I kind of said the same thing. Like, it's just a lot more safer because they just have a better like background probably, and maybe deal with more patients of this kind of like type that are a little more like at risk for falls and stuff. So it's kind of nice just to have that like higher level of help, because it's like more complex patients. So like you guys said, like it would probably be like I would feel more comfortable like with the PT there for most of the things. But then once you kind of got to know the patient and got more comfortable with like their abilities and stuff like that, then like the PTA can like take on a little bit more.
Mhm.
Yeah, I kind of had most of that. So I just kind of feel like maybe it's like more of like a one of those it depends type answers. Like if the patient is progressing well through everything you're giving them and doing well with like all of their transfers and stuff, then the PTA could be more involved. Like they definitely should know like what's going on from the start, like with the patient, like all that stuff. But like they're not progressing well or something's not going right, then maybe it should be more PT focused rather than that PTA always around.
Mhm. Yeah, it's definitely to the discretion of the PT.
Yeah, it seems like a PT would be really good for this patient just because, they're progressing through all the Ranchos levels and it probably would require reevaluation, which we know only PTs can do. But and they're kind of a high complex patient, especially with TBI, I feel like is the most complex of any of the neuro patients maybe. But but yeah, like you guys are saying, I could really see how a PTA would be able to help a lot with these patients, especially having another person there for transfers. And yeah, they'd be able to do a lot of stuff within their skill set too. So yeah, I feel like it kind of depends as well.
Do you guys want to move into explaining the different professions and how they can
Yeah,
their role?
yeah. We can probably just combine those two, right? Like talk about how other disciplines support PT and then how PT sports
Yeah, yeah.
take a turn. Okay. Cool.
Should I go first?
Sure.
Go for it.
Sure.
Okay. I looked at like a psychologist role with this, and like psychologist, neuropsychologist, I think was one of the options. But obviously with getting TBI in the first place, and then an upper extremity amputation, like your day-to-day life just changes a lot in general. So there's going to be like a lot of emotional adjustments coming with both of those. And so basically just the role psychologist, just helping the patient like process everything that happened, because I also went through like a traumatic accident at the same time. So just helping them kind of process all that, kind of giving them some like coping strategies to help them like with their mental health, so they can like kind of make more progress in their physical health as well. I feel like they kind of go hand in hand. What else? Also with TBIs, just kind of evaluate. I feel like psychologists can help PTs because they can get a better understanding of their like cognitive state and like how they're functioning, just like with their memory, attention, all of that. I feel like they can get kind of a closer look of that, or maybe even like look at it through a different lens. And then they can kind of communicate that with us and maybe like give us ideas in order to like us ideas to like help them in their PT, that like maybe things like we wouldn't have thought of before, like different ways to communicate with them, just different ideas like that. Yeah, I think that was the bulk of what I kind of looked at for psychologist's role.
I can go next because I feel like social work is kind of similar in certain aspects. But basically social work focuses on helping the patient navigate like the healthcare system, the psychosocial assessment plans, plan of care, advocating for the patient, providing education and counseling, kind of just like coordinating all the resources that the patient can use. And for this patient, I'm sure they're going to need like quite a bit of resources because this is a pretty like life-changing event. But I kind of liked, I saw one description of like a social worker kind of acts as like a liaison between the patient and the healthcare system to ensure that they can get access to all the necessary services they need. And like kind of on the flip side, the physical therapist can kind of help the social worker understand like the specific physical challenges that the patient is facing, which allows the social worker to kind of better assess like the patient's environment and support system. So they definitely like work hand in hand. Patients also will probably experience like frustration, depression, anxiety, kind of similar to what you're talking about, Jaden, which will definitely likely affect their motivation. So social workers can also provide resources for like counseling, coping strategies, emotional support, stuff like that. And then both physical therapists and social workers can play like a key role in discharge planning. So physical therapists can provide like certain recommendations for ongoing therapy, while a social worker can kind of help the patient transition into like home care or arrange for different services, and kind of just help them adapt in their life after they leave like a certain physical therapy unit. So I think they complement each other pretty well.
I can go next because I think that I covered the role of the priest, the chaplain, or the clergyman. And I think that ties in really well with both Jaden and your Sydney kind of professions that you guys looked at. And so for me, when I think about the priest, I think, it's about helping him kind of answer a lot of those hard questions that come with such a traumatic event, right? Losing a limb. It's going to create a new identity for this individual, more likely, along with the TBI as well. So both of these two things can send a patient into almost like a crisis. And so the chaplain's role to help support that patient go through that, offer different resources that are available to him through a church or a community. And then I also think a big role is family support. And so not just being there for that patient, but also being there for that patient's family and helping them process this grief and this loss of that individual. So being there for the mom. And I think that's really where the clergy and the PT can really kind of like, that to me is where that connection is. Where the PT is also there to help educate the family, or in this case, the patient's mom. The PT has a huge role in that as well. Both of them looking forward at what life is going to look like for this patient, but kind of with different lenses, if that makes sense. And so, yeah, I think family support, coping with new identity, all of those things kind of tie together with those two professions.
I can go next. So I did OT, which I think has the biggest overlap with PT, especially for this patient with like learning how to use the left side more, and just especially with the different cognitive and just perception deficits from the TBI. But I put that OTs can support PTs by really dialing in on like the fine motor skills and working on that coordination, and they can even make recommendations for potential like adaptive equipment or like home modifications that they might think benefit the patient during their sessions. And then it's nice because then it's like if they have close communication, then they can make sure that they're doing separate things between OT and PT, and there's not overlap, and they can really dial in on specific like goals with each, or with the patient for kind of each specialty. And then I put that the PT can support the OT by just focusing on like those gross movements, like bed mobility, transfers, just overall ambulation, and then how that can have an impact on just like overall function. Because I think even though it's like fine motor versus gross, there's overlap, and I think benefits in one can help the other. Yeah, that's it.
All right,
Nice.
I'll go next. So I had the prosthetist. And so we know that like the prosthetist is going to support PT because they like know all like the biomechanics behind like that joint. So they'll like understand like the socket and everything to like help them like adapt to exercises and like those trainings. And then the biggest one that I found with like the fit and stuff is like how we talked about how they have like depression, anxiety, things like that are common in like TBI and those things. Like a proper design and like fit that would help the patient would go a long way to maybe helping that anxiety because it's what works best for them, and it's like can give them an aesthetic component, if that makes sense. And they're also like there to educate and train the patient like how to use it, maintenance, and like what to do with it. And so PT will back off the prosthetist because they can see like how it actually is moving on the patient like functionally rather than like theoretically, if that makes sense. So they can provide like differences and like, well, it says it's supposed to be moving like this, but maybe we should adjust it so we can do things like this. And then from there, they can help with that prosthetic, moving them into more like functional training and like actual exercise and like a return to those strategies that we talked about earlier. And then how, like we touched earlier before, like advocating for like the adjustments and different things that you could need on a prosthetic would PT would help with.
Nice. So I did SLP for speech language, and yeah, I really wanted to learn more about just how what they do. And yeah, there's lots of good strategies they provide for physical therapists, and examples. So, something that they were saying is that they could like make a little diagram, kind of like a RPE chart, like with smiley face and things like that, but things like a picture of someone walking or food or bed, things like that, for them to be able to communicate what they're wanting if they're not um, able to get across what they want verbally, especially in this like confused and inappropriate stage. And then also like providing a notebook for them to write things down for like recall with their memory. And then uh, instructing the PT to remember to direct exercises with just 1 or 2 steps. And then you could also say, put like red tape on one of their shoes so that they know the order of how they're able to do exercises. And then yeah, so lots of things like that. And then the PT is able to help the SLP, just by kind of incorporating those same things that they're using. And then one way is for them to do their exercises while doing cognitive tasks, like, kind of like the tug cog, like something like counting backwards by threes, or, listing all the fruits, just having them think about something cognitively. And then a really cool one that I want to share is, because we're going over cardiopulmonary stuff, is diaphragmatic breathing could actually help them with their vocal projection to be able to, you know, have enough air behind their words to be able to communicate better. So I thought that was cool.
Can use diaphragmatic breathing for everything.
Yeah.
Okay. Do we need to, was there a point where it said like talk about like what you learned or something? Can we
Yeah. Just
No.
quick.
Well, I don't know, just like an overarching theme, I'm sure you guys all agree. I like knew all these things, like we all kind of like work together, especially like in a more inpatient setting compared to like an outpatient. Like I knew all these professional roles, whatever, work together, but I feel like kind of all of us like talking about what each one does kind of reiterates that fact, and just how well it kind of like complements each other, and how it can make like us treating the patient better because we were able to like know more about them, like how they learn, like smaller things if they need help with anything like that. I feel like it helps us to like better treat the patient and like get them to their goals.
Mhm. Yeah, I agree. And just having that communication between all the different specialties that the patient is using, just because they all have the same goal of making sure he gets home and is functioning to the like most optimal way he can. So
Yeah, I would agree. And then also just acknowledging like when something is more out of your scope of practice and being able to refer the patient to someone else who can help them probably better than you can. It's good to have those connections and be able to do that.
I think also what I kind of learned and took away from one of the video points, as well as this conversation, was also that it helps to know not just the scope of practice of the other professionals that you're working within your team, but also kind of know their personalities and their strengths and their relationship with their patient. Because a lot of these professions do have overlap, right? The psychologist, the social worker, the chaplain. There were certainly aspects of their role that overlapped, and knowing which person in the team might be best suited to approach a certain conversation or a topic or have some conversation with the family or the patient, I think is really helpful as well. And so kind of acknowledging that it's not just about their role as that professional, but also their role as that person, I think is something to keep in mind when we're working with these teams.
Good point.
Yeah. I thought what was really cool is that, you know, we each have our own areas, as, you know, health professionals or whatever. And, you know, physical therapists, we could do really well in our, you know, in our lane, like with the musculoskeletal things, but that's not going to make them have a second arm, you know, like the prosthetist is able to, you know, help them with that. So then they could do things, you know, two-handedly. And, you know, we don't learn a whole lot about mental health, whereas a psychologist would be able to help them with that. And so, yeah, I feel like working together as a healthcare team will really help that patient to reach all their goals.
How are you feeling?
Looks like we're winding down on time and we're well over the average time, but it was flexible. But I think we've kind of covered all the bases. I don't know if anybody else wants to add anything or if we can call it good.
Good.
Nice job, guys.
Cool. Stop the recording.